Dan, welcome back to our next episode of The Patient Voice Amplified.
Yeah, this is going to be a fun one today, Adam.
Absolutely. We've got the CIO of the Mayo Clinic, Cris. As you remember, we interviewed Ed Marx recently about a book that he and Cris are working on, and now we get to hear Chris's perspective on things.
Yeah, it'll be fascinating to hear how his personal healthcare journey is impacting the work that they're doing.
Yeah, that seems to be a theme of a lot of our guests, isn't it? Sometimes our own journeys propel us into a more patient-centric approach on all of these things. So let's invite Cris in, and we'll learn from him today. Here we go. Cris, welcome.
Thanks, Adam. Nice to be here.
We are excited to talk with you, and as you know, we recently interviewed Ed Marx, your colleague that you're working on a project with, and we're excited to get your perspective on that. So, Cris, can we just ask you to do a brief intro and tell our listeners a little bit about yourself?
Sure. I've now been at Mayo Clinic for 9 years, which sort of surprises me. It feels like I just got there recently. I accidentally got into healthcare in 2003 when a former colleague invited me to join him at United Health Group. And at the time, I thought that was a bad idea. But within a couple of weeks, I was accepting an offer. So I worked at United for a while. Then I was recruited away to join the team that was building Minute Clinic, which is basic healthcare in a drugstore, which is now run and operated by CVS. Left there to go to, was recruited to join SureScripts to build out their clinical exchange business. Messaging between doctors, not just messaging between pharmacists and doctors. And then was recruited to Mayo. So I've had a range of different kinds of experiences in healthcare in the last 17, 18 years. But a lot of it, frankly, has been accidental.
Well, you've certainly been on a journey and seen a lot of different corners of healthcare. And as you know, Cris, the purpose of this podcast is to help amplify the voice of the patient, and specifically in technology and healthcare. And we'd love to hear maybe a few things you're doing at the Mayo Clinic to focus on the patient. What does that look like from your seat?
Yeah, about a year and a half ago, we created a dedicated unit, our Center for Digital Health, to address exactly this issue. So it's things like modifying and improving our patient app, which is already really great, to be even more patient-centric. It's things like wayfinding, it's things like patient self-scheduling, an accretion of small things as opposed to, one or two flashy big bang kinds of things.
And what kind of response have you seen from patients? How are they responding to your efforts to think digitally first?
The products that they've been working on have not yet been rolled out. So the only feedback we've got is from focus groups and so on. It appears positive, but I think our Center for Digital Health is going to be rolling out their products early part of next year.
Cris, as you think of our industry and in general, how do you think we're doing listening to patients and including them in not only aspects of their care, but the technology needed to encourage them to participate in their care? Maybe give us a grade as an industry. How do you think it looks today?
Well, we probably have about a C+ grade, maybe a C. But in talking to hospitals around the country, as Ed and I have been pursuing our project, we're discovering that almost every hospital has a patient-centric program or focus that they've launched. Now, some of those might be window dressing only, but I think that most of them are very serious and are looking for ways to really think around how can we make the patient journey more effective and a better experience for them.
We're glad you brought up the project you're working on with Ed Marx and talk a little bit about the book. From your perspective, what's the overall goal and how is it progressing?
So Ed and I both have had cancer journeys over the last couple of years, and he and I have been friends for about 10 years. And we had spoken about our journey in a couple of forums and got responses from people that was somewhat surprising. They appreciated the fact that we were willing to talk about our illness and to match that up with our experience of being folks, embedded in healthcare systems. So, Ed took the lead on this and proposed that we work together on a book that focuses on patient-centricity. And based on feedback from our editors and our publishers and so on, we've really flipped the focus on that to be really a book aimed at patients or the people who take care of patients, where I think part of what we're trying to do is to, number one, be authentic about our own health journeys so that there's a sense of, common cause and that they should believe us as authors because we've been there. And the second is to some degree, draw back the curtain on how healthcare works in a way that helps us be a bit of an explainer to patients and those who take care of them around why are they encountering things that can sometimes be maddening, can sometimes be paradoxical, and along the way, at least from our perspective, provide some input about how to be a good patient. What sort of attitudes and approaches are helpful as you enter into a healthcare journey, whether it's a short episodic thing or a long chronic thing. I guess we've just got some experiences that we feel strongly worked for us, and we'd like to share those with others.
So I'm curious, as you've gone through this journey and are now working on this book together with Ed, how has this affected your perspective as an IT leader in the healthcare space? I'm sure it makes it more personal to you. How does it have affected your decision making, your strategy?
Yeah, for sure. So, my cancer journey began in July of 2018, which was 3 months after we had gone live with a giant system conversion at our main campus in Rochester, Minnesota. So, as I've said elsewhere, it was really a chance to eat my own cooking. And as I went through my medical journey, I could see places where the technology we had delivered, which had been designed by clinicians for clinicians, nonetheless was not working for them. It wasn't usually one giant thing. It was like 10 little hangnails or places where you stub your toe. So I think since I have spent time as a patient, I think I've become really a lot more focused on why are we doing what we're doing and trying to communicate that to our teams. That, what an IT department does is to save lives. And that we have a significant part in that. And then the second is just to see how I can do my part to prioritize those things which make the systems more usable for clinicians and for patients, and thereby improving the experience for everybody.
We appreciate you sharing your perspective, especially as a patient. And Cris, we're pulling for you and are cheering you on your journey. So thank you for sharing about that. Tell us, what are there one or two key learnings that have jumped out at you as you've written this book and as you're working on it? Anything else you want to share with our listeners that is bubbling to the top so far?
Yeah. We've got very much a provider centricity. That's where we function and work, and that's what we want to talk about. I would say that one of the things that if I were to try and look at a root cause of what it can be bedeviling, that I used to see time after time, is organizations that are process-centric, where they've figured out how to do one thing, fill a script, take an order, enter an order, and instead begin to think about some of those things not as discrete processes which need to be optimized for purposes of safety and so on, but into a service as it's delivered and received by a patient. I can think of lots of examples of where I ran into places where I couldn't get what I wanted. And it was because there was a process behind the scene as opposed to a service. So for example, trying to schedule chemotherapy sessions. I knew I needed to have 8 chemotherapy sessions, and I really wanted to do them on Mondays or Tuesdays because it had a whole domino effect on how I could work part-time and how I could do some things to meet some other obligations. And I couldn't get the appointment set because the process said, don't set an appointment until the oncologist approves it, and the oncologist doesn't approve it until you have a visit with the oncologist, which meant my planning horizon could be no more than 2 weeks in advance. Well, you understand why the process is there, right? They're intended to be for patient safety. They're intended to be for quality purposes. I get it. But from a service perspective, it's really lousy for a chemotherapy patient to not be able to set up their schedule of 8 sessions, which we know we're going to have. So I think organizations, if they really want to be serious about patient centricity, they got to think about what's the service that we're delivering to the patient and how do we organize and optimize our efforts around that service, as opposed to how do we optimize individual discrete processes which are behind the scenes and not visible to anybody.
That really resonates, Cris. You're reminding me of something one of our podcast guests said. You might know Rasu Shrestha over at Atrium, and he said that patients don't live in the silos that we create for them. And I think we could substitute the word process there, like you're describing. So that really maps to what we're hearing as well. I'd love to hear from you any examples of call it consumer-friendly technologies or patient-centered technologies, either inside healthcare or even outside of healthcare. What have you seen that makes you hopeful that as an industry we're progressing more towards what the patients need most?
Yeah, it's a great question. The fact is that, over the last 10 or 12 years, our industry has mostly gone from paper to electronic. And that's a pretty huge deal. We now have fertile ground on which to land new ideas. It used to be, if you go back to 2009, 2010, somebody could have a fantastic idea, but there was no substrate into which to embed it, right? And now we have an industry which is electronic and potentially headed towards digital. The things that I've seen inside healthcare is organizations that do things like operate their patient portal or their patient apps from an open notes perspective. I get all the notes from all of my caregivers. I can look at them anytime I want. And it's quite straightforward, and it's comprehensive. We have checks in place that if there's a really adverse diagnosis, for example, it doesn't show up in the portal before a physician has a chance to talk with a patient. But all those guardrails aside, I loved the Mayo Clinic app because it emphasized open notes. And I think there's lots of organizations that are doing that. Outside healthcare, you can think about a whole bunch of things that mimic the kind of experience that people have when they come to healthcare. Think about front desk kind of check-in processes and compare it to what happens when you're at the airport and you go to the clear counter, right? You go to the clear counter and it checks your irises or it checks your fingerprints and you're good to go because you've already been pre-registered. We know who you are. And we know whether you belong in pre-check or don't belong in pre-check. There's a ton of things like that have made the experience of, otherwise unpleasant experiences, have made them, more joyful. And I think we can bring a ton of those to healthcare. We don't have to authenticate the patient every time they walk through the door. Once we know what their identity is, and once we have a means, maybe electronic, to authenticate them, we can take a lot of burden away from patients and not have them spend so much time on, clipboard time, those kinds of things. So I'm very optimistic. I think the next 10 years we'll see this newly automated industry will now have a chance to become digitized will have a chance to think about services rather than processes. They'll be able to take in vendor products where before they didn't have a landing place for them. And I think we're going to see a much better patient experience.
Do you have any advice you would give to vendors as they're developing this technology, as you look to be more or less process focused, more service focused? What would you like to see from the vendor community as they develop this technology?
We have lots of vendors. What I would say is to vendors, don't try to own the relationship with the patient. You see that sometimes where they get excited about what they can do to connect with a patient, and so they want to own it. The patient relationship should not be to a technology vendor. The patient relationship should be to the organization which is delivering care. So vendors should pursue a strictly white label strategy, in my view, so that the health system can acquire those tools, integrate them with other activities, and provide a provider moderated experience to patients, because that's what you expect. If you're a patient, you show up at, St. John's Hospital, I don't want to have a relationship with a zillion vendors that St. John's happens to have picked. I want everything to be branded St. John's, and I want them to own it.
That's interesting. From your work history, you've been on the payer side, the provider side. How do you see the member experience fitting into all of this? Do you see the patients wanting to engage more with their provider? Where's an opportunity for the payers to step in and create a great experience and maybe a continuous experience for the patients?
Sure. I don't think that payers creating relationships and providers creating relationships are mutually exclusive. But I think the best ones will follow some sensible kind of patterns. I think the sensible kind of patterns is providers can be very helpful on things like reminders about adherence to medication and those kinds of things. And that doesn't really interfere with the doctor-patient relationship to say, hey, we noticed you haven't refilled your medication. It's important to your care. Please do so. But payers that are moving into the provider space, we see that happening for sure. But there needs to be some care given to not disrupt the relationship between the patient and the provider. From the provider's perspective, take advantage of what it is that the payers are doing, for good. And I think there needs to be an understanding that now that high deductible plans are becoming more and more and more the norm, the relationship between a patient and a provider is going to change as they try to find more economical ways to get through their $5,000 deductible, to meet all their family's patient care, in a cost-effective kind of way. So there will always be some push-pull between providers and payers for sure. There's some places in which their interests aren't aligned, but there's places in which they are.
That's fascinating. I love how you mentioned the high deductible plans and the patients becoming more engaged in their care. Recently, federal mandates went into place around price transparency. What are you doing at Mayo to help facilitate that and empower the patients as consumers of their care?
Yeah, so we complied with that rule early on and wanted to do a good job with it. It's important to do price transparency on discrete kind of services. What does a CT cost? What does an X-ray cost? And on bundles of care, what does a knee replacement cost? What's a hip replacement cost? And we can be relatively accurate about those things, set a reasonable expectation, and not have it feel to the patient like there was a bait and switch. So we're publishing all those materials. Frankly, we're not yet publishing them ourselves. We're publishing them through the federal government's process for price transparency. And we know that gets harvested and used in consumer-facing apps and those kinds of things. And that's fine. As long as it's accurate, we want people to be able to know what to expect when they come to Mayo Clinic. The challenge will be our real specialty is in treating complex and serious conditions, perhaps that can't be treated someplace else. It's sometimes hard to predict what the costs are going to be when there's a medical odyssey involved or extremely complex surgery that might involve other teams. So I think we're going to struggle with providing, complete price transparency for what is it going to cost you to come through this journey associated with your complex or serious condition.
It makes sense. Cris, what advice would you give our provider friends that are listening as they consider ways to be more patient-centric? What else would you share that you haven't already told us today?
Yeah, I think maybe two things. One is really listen to the voice of the customer. And we know that there's third-party organizations like Breast Gaining and others who do a really good job of getting patient feedback about what they liked and what they didn't like. So I think an organization has to do that and has to take it seriously. And then the second thing I would say is, in order to create a great patient experience, you need to engineer services that can be delivered in a way that patients want them to be delivered, and not processes which create invisible walls and frustrations for patients. And that'll be tough. Convincing organizations to let go of processes in favor of services is very difficult in a world where most of those processes were set up to achieve really important ends for the organization around safety or efficiency, those kinds of things.
I think that's going to be the theme of this episode, service over process, and really appreciate that perspective. Cris, I think we could talk to you for 4 more hours, but we better let you get on to solving the problems of healthcare. Any parting thoughts for our listeners today?
Well, I think thanks for the opportunity again, Adam and Dan, to talk with you. The only thing that I would really say is having a patient experience has affected me in ways that are pretty profound and simple. And if you haven't had a chance to be a patient, most people have, find a way to walk with patients, find a way to get closer to where the care is being delivered. Try to understand, what's happening at that point where the patient is delivering care, and see what you can learn from firsthand observation and experience. Healthcare is enormously complex. It can be dire. It can be life and death. It's hard to understand, frankly, but I think we can do much, much better. And again, I'm excited about our journey as an industry over the last decade. I can hardly wait for the next decade.
Well, thank you for that perspective. And we are looking forward to the publication of your book. We've already asked Ed to send us a few copies. We might have to have you and Ed come on as our return guests at some point. But we wish you the best on your healthcare journey, and thank you for what you're doing. There's so much partnership needed in healthcare to figure this out together, and we're glad to hear your efforts and spirit of collaboration. So we wish you the very best, and thank you for your time today.
Thanks very much, Adam and Dan.
Thanks.
Well, Adam, wasn't that a fascinating conversation with Cris? It was really interesting to hear him talk about services over processes and how that creates a more patient-centric approach. Did that stick out to you as well, or was there something else that he talked about that stood out?
That was definitely one of the highlights. It makes me think about, as we mentioned with Cris, Rasu Shrestha's comment, we've created these silos in healthcare, and that's just not how patients think. We need the service aspect. So I really appreciated that. I thought that was a great comment.
Isn't it funny? It's like that in many businesses. Oftentimes you put up processes for the right reasons, but then they sometimes impact your ability to deliver the value that you need to as an organization. So
yeah, absolutely.
It's just like that for an employee and a patient and all kinds of different roles.
He mentioned something a lot of our guests talk about is truly listening to the patient, and either refer to your own patient experience, walk with the patient. There's certainly that level of empowering and listening and connecting with the patient that needs to happen. So I was glad he mentioned that.
Well, that reminds me, you were telling me about a conversation you had with a vendor that's really put a focus on listening to the patient. Do you want to share with our listeners a little bit about that conversation?
You bet. So I was on a call with an EMR vendor, and I don't have permission to share their name, so I'll just say that they were presenting to us how they are developing their next round of technology, their latest release. And this vendor is interviewing thousands of patients. And as you know, this is something you and I are very passionate about, and we talk about a lot, don't we? We work with a lot of vendors. And so, but they were not only interviewing the patients, they were scoring themselves, they were tracking patient adoption. It felt really pioneering and unique. I was really impressed with it. It was one of those moments I ran over to your office and said, Dan, guess what I just heard? And so the other thing that they discovered, patients were actually going to the vendor for help finding their patient portal instead of their provider. And so this vendor realized they had an opportunity to help patients, and right on their homepage, they've got a way for patients to find their portal, get training on it, log in, talk about patient centricity. It was really refreshing.
Yeah, that's interesting. Oftentimes, I think vendors excuse themselves as not directly touching the patient and not having that interaction. But we've heard from other vendors recently that have started to have patient-facing tech support for telehealth visits and other things like that to just step in where they can. They don't have to be the primary touch point, but how can we help make this better for patients?
Yeah,
that's great.
It's a great idea. Let's go to our research minute and some things that we're hearing and working on. And Dan, you and I are part of a big project that we're going to talk a lot more about in a future episode. But will you talk about our patient voice project and some of the progress that's seeing right now?
Yeah, this is really interesting, and what a great topic to discuss it with everything else we've been talking about on today's episode. We just got done, we're in the initial stages of analyzing this data. We surveyed about 10,000 patients, just shy of 10,000 patients, around questions on how they engage with technology, what's most important, least important to them, what's making an impact today. And obviously, as a result of the pandemic, we had several questions focused on telehealth. And one of the things that we wanted to know is, was telehealth just a flash in the pan out of necessity during the pandemic, or will it truly have staying power? I think from what I've heard from friends and colleagues, there's certainly a demand for it from a consumer perspective, but it's nice to validate it with data. And I don't have a specific percentage, but it was around 2/3 of patients in this study. So we're talking 6,000 of 9,000 patients or so that shared that they plan on an ongoing basis to do the same amount or perhaps even more telehealth and virtual care going forward. And that just speaks volumes to how well the industry delivered that this last year and the experience that's created, and also their desire to have healthcare meet them where they are.
Yeah, certainly maps to the tone and the conversations we've heard on a smaller level, but like you said, it's great to get some specific data behind that. More to come on that. This is a major project that we're excited about, an upcoming class report, and we'll have our research partner, Frisia, come on a future episode and talk about that. They're the ones that helped collect that data, and we'll get their perspective. Okay, and with that, Dan, I've got a parting quote to share with you, like we like to do. So this is one I think you've heard of before from a company called Nike. Just do it. As we think about should or shouldn't we involve patients, just do it. It makes a world of difference, and it's we obviously are seeing in the data there's things patients need and want that will help them participate in their care. So how's that for a profound thought today?
I love it. Simple and straightforward. Easy to remember.
Well, we want to thank our listeners for joining. We appreciate your attending and listening to this podcast. Thanks again to our guest, Cris Ross of the Mayo Clinic. We certainly wish him well on his patient journey and appreciate his perspective. If you have ideas for future guests or topics, please reach out. We'd love to hear from you. As a reminder, you can send us an email at patientengagement@classresearch.com. Dan, thanks again.
You're welcome. See you next time.
Take care.